Good morning. My name is Nee. I'm a pharmacist, but more importantly, I'm passionate about your health. Today, I want to talk to you about diabetes. The reason is that because, according to the International Diabetes Federation, we have close to 300,000 Ghanaians living with diabetes. But the astonishing fact is that about 70% do not know their sugar status or their diabetes status. What are the implications of this? What are the complications of this? And why is this disease condition shrouded in a lot of mystery and myth? Diabetes is a disease condition where you have uncontrollably high levels of sugar in your blood as a result of your pancreas not producing enough insulin, or the fact that you are producing normal levels of insulin, but your body is not able to absorb the insulin into the liver cells, into the muscle cells, and into the other cells so that glucose can be used by them. So this leaves high levels of sugar or glucose in the blood. The complications of this are grave. One of the main complications of diabetes is a condition called diabetic neuropathy, where your peripheral nerves, which are the nerves that are found in the extremities of your body, that's your legs, under your feet, your arms, your fingers, don't get enough nourishment. And they don't get enough nourishment because the high levels of sugar affects blood flow. The high levels of sugar can also increase your risk of a disease condition called atherosclerosis, where because of fat deposition in the inner walls of your blood vessels, they become caked and they become narrow. So blood flow and then the supply of oxygen and nutrients to your peripheral nerves, they start becoming diminished. So your peripheral nerves start dying, and some of the symptoms associated with this is numbing sensation, tingling sensation, the fact that sometimes you have to hit your leg on the floor very hard before you feel that you can walk. What that could also do is that it could increase your risk of getting something called gas gangrene, where if you have a small sore just under your feet, because your nerves are dying, your nerves carry pain sensation to your brain, so that you say, okay, there's something that I need to do something about it. But because they are dying, you don't feel it. So the small sore can easily explode and become a very big sore, and then they have to amputate your leg. Another very important complication associated with diabetes is a condition called diabetic retinopathy. This is a condition where your optic nerves, because of the same conditions I've mentioned, they also start dying, and then it will increase your risk of blindness. In fact, diabetic retinopathy is the fourth leading cause of blindness in the world, just behind age-related macular degeneration, cataract, and glaucoma. It's very important to keep your sugar under control. One of the main things is to make sure that you exercise regularly, you check your diet, and more importantly, when I say exercise regularly, some people think that it's stressful, it's miserable when you have to wake up very early in the morning to do some aerobics. But what is even more stressful, what is even more miserable, is to see yourself rotting away and you can't do anything about it. What is even more miserable is to see yourself going blind and you can't do anything about it. What is even more miserable is to stroke out and half of your body becomes a vegetable and you can't do anything about it. It's very important for those with diabetes to make sure that they take their medications regularly. They always consult their healthcare provider, healthcare professionals, before they decide to not take their drug, or they decide to incorporate herbal concoctions into their disease treatment, because the complications and implications are very grave. Thank you so much for listening to me. If you have any questions, I'll be more than ready to answer them for you. Thank you.